morning, Ms. Gonzalez. I'm Nurse Linda, and I'll be taking care of you today. Today is September the 26th, 2024, and I'm going to be doing an endotracheal suctioning on you. Okay, so per doctor's orders, he says for us to suction you if we hear like you're in respiratory distress, or we hear some crackles, or if to help you breathe better. Okay, so I'm going to do hand hygiene. Can you tell me your name and date of birth? Francisca Gonzalez, 10/10/31. Okay. I'm going to look at her armband and verify that she is the patient that we are doing the endotracheal suctioning with. Francisca Gonzalez, 10/10/1931. Yes. Okay. So I'm going to listen to your lungs. Okay. I'm going to assess the patient's lungs. Upon assessment, the patient has coarse crackles on the upper and lower lobes. I'm going to check her oxygen level, and it's telling me it's at 90. So yes, you need to be suctioned, okay? If at any time you feel it's hurting you, or you're uncomfortable, or you feel anxiety, you look at me and I will stop, okay? Or you can hold my hand or squeeze my hand, and you can tell me to stop. I'll stop. Okay, so at this time I'm going to turn on the suction machine, and I'm going to set it to 150 mmHGs, and that's the maximum dose for an adult. And I'm going to turn on my oxygen to the highest level, and I'm going to it's going to be connected to my ambu bag, which I'm going to bring over here and set it right next to Ms. Gonzalez. You doing okay, Ms. Gonzalez? Very good. Okay. I have a little towel here I'm going to place on her. Okay. And I'm going to adjust the bed to the height where I can work with her. I'm going to lower the bed rail. And I'm going to put her at semi-Fowler, or if she was unconscious, she would be placed in a lateral position facing me. So we would put a pillow behind her right here. Okay, so I'm going to go ahead and take my gloves off. Perform hand hygiene. You doing okay, Ms. Gonzalez? And I set the connecting tube close by, so it would be in a convenient place for me to get it, and I wouldn't have to be looking for it or anything like that. Okay, so I'm going to open my endotracheal tube kit. Making sure that I'm not breaking sterility. I'm going to open it. And I'm going to take the little box out, being careful not to touch the inside. Place it there on the side. And I'm going to pour normal saline in it and just lip it. Then I'm going to put my goggles, my face mask, and then I'm going to put my sterile gloves on. I'm going to put it on my non-dominant hand first, and then I'm going to do my dominant hand. Okay. Now I'm going to take my catheter out. With my sterile dominant hand, I'm going to loop it around my hand, and then I'm going to, with my non-dominant hand, I'm going to reach for the tubing that's connected to the suction, and I'm going to connect it, being careful not to break sterility, to the tubing. Okay? Now I'm going to pre-oxygenate my patient. So I'm going to remove I'm taking the tubing off her oxygen tubing off of her, and I'm placing it right there on the side. Then I'm going to take my ambu bag and I'm going to give her 3 to 6 breaths. 1, 2, 3, 4, 5, 6. Okay? Now we're going to test the tubing. Okay, and it works. There's no occlusions. And then I'm going to take my catheter, and we're going to go down the endotracheal tube only as far as resistance. And then I'm going to circle it as I'm coming up. And as I'm coming up, I'm going to suction 10 to 15 seconds. Every 10 to 15 seconds. Every 10 to 15 seconds. Not doing it too many times. Okay, then I'm going to loop it around my hand, and I'm going to oxygenate her again. 1, 2, 3, 4, 5, 6. Okay, and if I hear more crackles, then I would go back down after I clean it with the normal saline. I would go back down and I would do it again, but I don't hear any. So at this point, we're going to suction her mouth because she's got secretions in there. So I'm going to go in her mouth and suction her for secretion. Okay? Being careful not to put it back in her endotracheal tube, because that would introduce bacteria, and we don't want that. We don't want her to get sick. So what we're going to do, we're done. I'm going to disconnect it, wrap it around my hand, take it off with the gloves, throw them away, turn off the suction, turn off the oxygen, put the tubing, the endotracheal, or the ventilation, put in the ventilation on her. And then I'm going to clean my area. I'm also going to give Ms. Gonzalez some oral care. We're going to give her some oral care. Okay? Ms. Gonzalez, how are you doing? You feel better? You did a wonderful job. You did really good. I'm going to reassess her oxygen saturation, and it shows that she's 98. So we achieved our goal, and that was to remove all of the secretions. She has no secretions right now that I can hear. So I'm going to reassess Ms. Gonzalez at this time. Okay. And I don't hear any crackles on upper or lower lobes. And I threw away the catheter. Now I'm going to raise the bed rail, put the bed at the lowest position, make my patient comfortable. Ms. Gonzalez, are you okay? Do you need anything? Are you fine? You can breathe better? Yes, ma'am. It sounds like you can, and you did a wonderful job. So after I put the call bell on her side and she's comfortable, I would document respiratory status, including the rate. I would the oxygen saturation. I would record that. Her lung sounds. A presence of any drainage or secretions from her trach, and the type of air that she's receiving, artificial air that she's receiving, airway, and that would be it. Thank you.